When someone comes and has diarrhea, abdominal pain, it's hard to sometimes differentiate whether there's two disease entities, irritable bowel syndrome, or IBS, or inflammatory bowel disease, or IBD. And some of the things that kind of help differentiate the two are if you're having a lot of bleeding, weight loss. A lot of times that may be something more concerning, what we call inflammatory bowel disease. Whereas often people, especially young, healthy women, for some reason will start developing abdominal pain, more diarrhea, and it can last really for years. We see that all the time. Up to 10% of the population may have some form of irritable bowel syndrome. And so common things being common, that's the more likely diagnosis, but how do you tell the difference? And a lot of times what we have to do, we'll talk to you, go over the symptoms. There's some things called Rome criteria that we can go over. A lot of times, sometimes we need to do a colonoscopy. And someone with IBS will have a completely normal colon. Those with inflammatory bowel disease will be able to see the active inflammation, take biopsies, make a diagnosis, and then treat. And the treatments are quite different, where if someone has inflammatory bowel disease, we'll give you medications to suppress your immune system because that's the underlying cause. Your immune system is attacking your own organs, and that specifically being your colon or intestines. Whereas irritable bowel syndrome, the underlying physiology is that your gut is just abnormally sensitive to what should be there, which is water, food, things like that. And so we'll treat the symptoms. If you have a lot of pain or abdominal bloating, we can give you medications to help sort of decrease the spasms and make the pain feel better. If you're having a lot of diarrhea, we'll give you medications to slow the diarrhea down. There are some other newer medications, such as antibiotics, that may help that as well. If you have the other variant, which is more constipation predominant irritable bowel syndrome, then we'll give you medications to help your colon move forward and make it less sensitive to the distension that your colon's having.